And just for formality, let's introduce ourselves, and then I'll turn it over to Councilman Troop.
I give that to her.
Hey, there he is.
I'm sorry.
Okay, Mel Witherspoon, member of council.
Tyler Titus, member council.
Kathy Schaaf, ditto.
I'm Danielle Mina. I'm project manager with Boswick Design Partnership.
Dave Brennan, I'm a partner at Boswick Design Partnership.
Matt Harris, Vice President of Eastside Renaissance.
Olivia Heibach, CEO, Multicultural Health Evaluation Delivery System.
Jasmine Flores, City Council.
Mo Troop, City Council.
Chuck Nelson.
Me.
Yeah, you
Late.
got it, Mo.
Thanks, Mr. President. I'd like to thank Mr. Harris and the rest of his team for coming down today with the Renaissance, Eastside Renaissance, and talk about a project that they mentioned to me, and I thought it would be great for the rest of the City Council to hear about it. So with that, I'd like to turn it over to your team.
Thank you. I appreciate that, Councilman Troop, and thank you everyone at City Council for letting Eastside Renaissance and the MEDS team come over and explain what we think is an important project that's going to be taking place and has been taking place on the Parade Street corridor. This capital improvement project has been in the works for the last couple years. We presented to, in your handout, you'll see some information, kind of an overall white paper describing the program in detail, some of the supporters there. And so I thought this capital stack that we've secured thus far, you'll see that in the document, that we are here in a request for $1 million loan. Chris Groner, I thought, was going to be here. I've been talking with Chris for the last 2 years. Chris and his program supported, I think, $250,000 with the 901 kitchen, with the Taste of Love kitchen for us. And so we would come back and talk to Chris about $1 million regarding this project. You'll see the capital stack once again there. We understand that there's going to be a transition with administration, and so 2026, we're not expecting anything before that, but we felt that it was important to update City Council and what's coming in 26 with this project, and we have our team here to talk about that. So for sake of being redundant with the information you see here, and I don't want to take time because I want to leave time for Q&A, I'm going to turn it over to Olivia, who's the CEO of MEDS, and she can go into a detailed explanation of what MEDS is about and the importance of this happening along the Parade Street corridor. And I think she has a PowerPoint presentation to talk about.
Are you going to do, okay, can I have the next slide, please? So this project is really about, we talk about building neighborhoods of the future, healthcare access in the Lower East Side. It's critically important that we continue to invest in the Parade Street corridor, but building attractive neighborhoods, part of that is having doctors that people can go to. And MEDS is committed to investing in this neighborhood. Next slide, please. A true story. Next slide, please. Nope, I should have taken that slide out. We are invested. Next slide, please. We believe in a vibrant, inclusive, and successful Parade Street corridor. You may have noticed we did open an office, next slide please, at 826 Parade, next slide please, at 826 Parade, October 24th of 2024. And that office is staffed by an internal medicine doctor who has dual board certifications in gerontology as well, which is huge for that neighborhood. There's very few gerontologists in the city of Erie, period. And then a physician assistant and part-time a nurse practitioner who is a pediatric specialist, because we know that people in that neighborhood need access to healthcare. We projected that we would see 2,000 patients in year one of operations at that location. We saw 2,000 patients in the first 4 months. People need healthcare along the Parade Street corridor. And at this point, although that building's been open for a year, we've outgrown it. So we need additional space. When we put this together, we were at 9,000 patients and counting. So that was 6 months ago. Now we're over 10,000 patient visits a year. MEDS is busy. We're really busy. 2,000 residents of that 16503 zip code lack a healthcare home. They don't have a primary care physician. They don't have access to behavioral health counseling. It's a desert. It's a healthcare desert. 56% of that neighborhood makes less than $19,000 a year, which is really important to keep in mind. And this is something I talk about all the time. My office sits at 2928 Peach Street, which is pretty close to Federal Hill. If I get in the car and drive to our office at 826 Parade, say I live at 2928 Peach Street or I live at 826 Parade, I've lost 10 years of life expectancy in that 10-minute drive. That's unacceptable. People shouldn't be living 10 years less because they live in poverty. Med sees everyone in our service area regardless of their ability to pay. We offer a sliding scale fee for those who are uninsured or underinsured. And if the sliding scale fee is still too much, we offer a nominal fee, which is $20. It's $20 to see the doctor, to see the counselor, to see the chiropractor. And if you can't afford that, then we're just gonna waive the fee completely. And you get to see a doctor for free.
With the Parade Street location, does that make the third location for Meds?
That's our third
All right, 'cause
location.
there's the Meds Harbor Homes and then the Peach Street and then Parade, right?
We're not at Harbor Homes anymore. We're in the basement of the JFK Center.
Okay, all right.
They're right across from the WIC office, which is really convenient.
When I was a medical assistant at school, 2012, 13, I did my externship for Meds Harbor Homes.
Oh, okay.
So that's why I've known of the organization and the work that they've done in the community, regardless of people's ability to pay and ability of language access, because they've always pride themselves on hiring staff that actually can speak the language of the community that is patronizing the facility. So
Right.
I'm happy to see that you guys are growing.
Yeah.
Yeah.
The past 18 months have been wild. Can we get, next slide, please? We'll talk about sustainability and budget. Next slide, please. So how does Meds exist? This is always a really important question. Like, is this a safe investment? Is this organization sustainable? Meds is a federally qualified health center lookalike. What that means is that every Medicare and Medicaid patient we see, we receive a flat rate. Instead of our physicians, our mid-levels, they don't have to upcode the chart. They don't have to say, all right, that was a 3 or a 4 or a 5. Whether you come in with an earache or a heart condition or chronic diabetes, we get the same payment for that visit. And that doesn't impact the patients. That's why our organization is sustainable. We also hold the Refugee Health Grant for this region. There's 5 refugee resettlement regions in the state of Pennsylvania. We're the sole grantee in Region 5. The majority of medically complex refugees that are resettled in the state of Pennsylvania are resettled to Erie because Meds is here. We staff from the community we serve. That's really important. 86% of our staff speak a first language other than English. 90% of our patients are best served in a language other than English. And that's important to our mission. We reinvest in education for the staff. The Pennsylvania Department of Health does reimburse us for conducting initial refugee resettlement screenings. You may be wondering, what does that mean now? Because refugee resettlement stopped in January. I'll answer that question you didn't ask. That was 20% of our budget. But because we opened this office at Parade Street, because we're opening more offices on Parade Street, the demographics of our panel are shifting. Meds has for a long time been Erie's healthcare home for refugees and immigrants. But we want to be Erie's healthcare home for everyone who doesn't have access to healthcare. And so as our panel shifts, we've been able to make up that 20% in our budget, and actually will finish this year as our most profitable year ever as an organization. Next slide, please. So by increasing healthcare access, we contributed to the narrative that Erie is a community of choice. For families, I'm a mom, I have young children. Part of where we decided to live was access to high quality healthcare. I live in Northeast, I don't live in the city. Next slide, please. Next slide, please. So, improved access to essential healthcare services for the residents of the Lower East Side. It ensures that young people and their families maintain their health and well-being, and it mitigates the need for people to relocate for better healthcare options. So I know that if I can't get into the doctor for 3 months, if my kids are sick and they can't go to the doctor, I'm starting to think, is this where I want to be long term? This community hasn't made the investments in my family. Am I going to continue to invest in this community? Next slide, please. As I said, 85% of our employees speak a primary language other than English. We actually, at this point, employ more native Ukrainian speakers than native English speakers. And then I just want to touch on the employment opportunities that this project can provide. We're going to create jobs for residents, contribute to economic growth and stability. There's indirect benefits to local businesses. When we talk about reinvesting in the Parade Street corridor, creating jobs means we have people who are going to go and eat lunch at Taste of Love. We're going to make sure they stop by Krause's on their way home, because if they don't have it, you don't need it. We're committed to hiring locally. We're providing careers for young people, and we're encouraging young residents of the city to stay in the city. Projections, we think this building will probably allow us to add about 50 new jobs. Next slide, please. Next slide, please. Yeah, and I touched on this already. Vibrant and supportive community engagement, environment, higher retention rates in local schools and businesses, and increased community activity participation. Meds is really committed to this neighborhood. We had an emergency strategy session this morning talking about how are we going to make sure people have food access when SNAP benefits end, because 90% of your healthcare outcomes happen outside of a clinic. So we're making a multiple $1,000 commitment, and I'm going to go buy food tomorrow. We're going to make sure that there's food at every local business around the Parade Street corridor, because we know SNAP's ending November 1st. Next slide, please. I touched on community collaborations. You're right here. We work with the resettlement agencies. We work with Eastside Renaissance. HRSA is our the federal agency we kind of answer to, and then PAC is the Pennsylvania Association of Community Health Centers. There's 54 federally qualified health centers and federally qualified health center lookalikes in the state of Pennsylvania. You are all, I'm sure, familiar with Community Health Net. That's the largest community health center in this area. Next slide, please. So again, workforce demographic data, we prioritize hiring qualified professionals from the communities we serve. We're committed to the professional development of young individuals aspiring to careers in the medical field. Meds is unique in that we'll cover the cost to get your certified medical assistant certification, which is a huge barrier for folks, as we talk about $6,000 to $7,000 for the certification, and you don't get paid for your training hours. We take care of that. We provide a lot of financial assistance to obtain necessary certifications. We've also paid for many of our staff to complete community health worker training. Next slide, please. There you go. With your help, we're poised for success. Thank you.
Olivia, could I just ask you, and not putting you on the spot because you know this answer, regarding what this also does in regards to the ERs? And I know...
Yeah. So when people have access to primary care, they stay out of the emergency rooms. And an earache isn't an emergency room visit until it is, because you can't get antibiotics anywhere else. And so we work closely with UPMC Hammett, we work closely with AHN St. Vincent's and LECOM, because they know that if more people are being seen at primary care level, if more people's chronic health conditions are being managed, we're seeing a lot less folks in the ER, and that's good for everybody. That's good for every taxpayer, honestly.
Okay, thank you.
Yep.
I want to ask a follow-up question similar to that. Is there any data to show if your presence is also reducing like EMS service rides, like ambulance service rides? Because I know that is a huge issue. And so when we have more accessibility, less people are going to need, because they don't have access to a vehicle. Right. And if they can walk to where they're going, right, you're less likely to take an ambulance to get to where you need to go. And this is a huge county-wide issue.
Right.
And so I would just be curious to see that. I know that's a very, very specific kind of question, so I didn't expect you to have it right now, but I would just be very curious around that one.
I'm gonna have to dig into, that's not something we track because we don't have ambulances, but I think that's a really interesting question. I would love to reach out to Emergicare.
To just see how many people are using in those neighborhoods versus coming down.
Like, it has utilization rates decreased?
Dropped in those areas.
I really like that question. I will look into it. Thank you.
Do you have bilingual in each area of your location?
We do. We have bilingual staff at every location. Of our medical provider team, we have 12 primary care providers, and about half of those folks are bilingual. all of our medical assistants and all but one of our front desk staff are bilingual. Now, at each office, you might not have, for example, we don't have an Arabic speaker at the Parade Street office right now. That's something we're trying to hire. We have, but for the most part, we can cover, there's like 8 primary languages we see, and then 40 others, like, as a one-off. We have staff who speak each of those languages.
Thank you.
Thank you.
Do you take people from the surrounding area, like Northeast, Harbor Creek, Fairview, what have you?
If you make it to us, we'll see you. And this isn't part of this project, but we're actually raising capital to purchase a mobile medical unit so that we can bring primary care to rural Erie County.
So instead of going to like the emergency room at Hammond, I could walk in.
Yep. And we actually have pediatric urgent care hours at night because we know, well, I know because I'm a mom, my kids don't get sick at 1 p.m. because that would be very convenient. Like, that would be far too convenient. It has to be after our doctor's office closes. And we have Saturday hours for walk-ins. We make sure there's room in the schedule every day for same-day appointments.
Mentioned the pharmacy and the dental, which very important in regard to that area, what this facility will have.
So, and Boswick, I'm sure we'll talk more about what's
Okay.
going into the building, but just driving around the city, you can see how many pharmacies have closed. Rite Aid was a huge loss for a lot of folks. Part of the goal of this project is that we're going to be able to have in-house pharmacy, and that's going to be really big for our patients.
Big time.
If you've ever been on Medicaid or a member of your family has been on Medicaid insurance, you know how challenging it is to find a dentist who takes Medicaid. This office will have a dentist, and that's going to be, just addressing those 2 needs is going to be so high impact aside from the primary care.
And also with that dental office, we're going to be working with the Erie School District with their schools, with Piper Burley being right around the corner. And of course, hygiene in schools is a very important component to learning without having toothaches and those sort of things. There's nothing in that area. And so we're going to be working with the school district and systematically bringing in students to get cleanings and that sort of thing. So that's a game changer. I wish we could have had the entire second floor, but Olivia needed other space. But that dental piece is a big deal, so we're excited about that in that area.
If I may, you're talking about $7,800 a month rent on a property that you would put hundreds of thousands of dollars in to repair? Or is the owner going to take care of what it is?
Well, our capital stack is, I'm sorry, I don't understand the question. Let me see. I don't understand.
I'm just going through here quickly. I'm outsider's
building?
purview, I guess.
The Eastside Renaissance owns the building, correct?
Okay, so you're gonna, this is being leased to Meds to rent?
Correct.
Okay,
Yes.
so Meds needs rent money to pay the Eastside Renaissance.
Who
Correct.
pays the $7,800? That's what I'm saying.
Yeah, Meds. Meds will be a tenant of the Eastside Renaissance.
No, okay.
Yes.
I was confused from that standpoint.
Yeah.
And the other big thing is, you can put your Dairy Queen back there?
We approached her.
You lived on the Lower East Side.
We
you
approached
know
her
what
actually,
Dairy Queen was.
and we approached her actually, and she has no interest in restarting it. She owns a home back there.
All seriousness, I applaud you folks. I was brought up on 4th and Wallace, so I know what I'm talking about when I make little jokes about Dairy Queen and Gym City ice cream on 8th Street.
Yeah.
That's how we lived.
Yeah. The Blue Moon.
And cantaloupe ice cream. and
Right.
that's it. Yeah, on and on with this, but again, we live that way. That's, you know, in the summertime, we went with the church bells. When bells rang at noon, we ran home for lunch. When the bells rang at 6 o'clock, we ran home for supper. And then we were back down to the park after that. Kids don't do that anymore, and it's kind of a sad thing. And maybe the park idea that we're going to be building on, we'll bring that back too.
Yeah.
But I went on record a long time ago when we helped Bishop Brock get the Eagles Nest gym. We don't do things for the East Side too often, if ever. And it's about time we start doing it.
Yeah.
Because there is an East Side of State Street.
Thank you.
And I pontificated about that, David.
On the Lower East Side are all set, so.
And there's more happening. Just before I let Boswick and Dave and Danielle go, 6 years, Eastside Renaissance is a grassroots organization, as you know. Over 6 years we've been there. And there's been over $10 million of investment and counting just along that corridor, more than what we've done. And other entrepreneurs and investors are coming to the area. There's some things that are going to be coming down the line in 26 that are going to be game changers also. We felt the bank was a game changer on the financial literacy component. We think this medical piece speaks for itself with life expectancy. And so as far as economic development, the tax base for the tax rolls of increasing property taxes, not increasing tax, but blighted property being brought back to life with major investment, it's a good component for city and taxes. Quick example, we have a $900,000 grant coming to a property we own, a 6-unit building at 701, 703 Parade Street. That's going to be starting next year. So that building is going to be, its tax roll is going to increase. So the ripple effect of economic development, capital improvement, to your point, Mr. Brzezinski, of more investment hopefully coming to the Parade Street corridor, similar to what's happening on State Street. We think there's value in that, and it's long overdue. So we're just happy to be a part of bringing all this together and doing our part. So with that being said, I'm going to turn it over to Dave and Danielle from Boswick. They do a great presentation, and will explain the intricacies of the building itself and what they've done thus far.
Great, sounds good, Matt. I first just want to say that it's really an honor to be working on this project. You know, as you know, Ed, I grew up on the Lower East Side. You were my teacher at East High School for 9th grade history. Going way back here, embarrassing you a little bit.
We were both very young.
Yeah. My parents still live at Trocas there, so we grew up in the 1300 block. So what I'm saying is it means something to me. You know, when Matt came to our firm to talk about this project, I was just all in. And yeah, when we started talking to Danielle about it, it was like, this is something that we need to get done because it can grow. It could be an investment opportunity for other projects to have the confidence to move forward. So I just wanted to say that to kind of kick us off here. But one thing I was going to intro, then Danielle's going to talk about the important part of the building, but just give a little bit about the history and the context of Parade Street. I'm sure you know Parade Street, it was named after the parade grounds from the military parades that used to go up down the Parade Street. So very important central artery for Erie. The late 19th century, it was just bustling. Yeah, I'm sure you've seen maybe older pictures of it. It was like another State Street. So it was really incredible, some of the pictures that we've seen, and we've talked to the Hagan History Center to get some earlier pictures of these buildings to try to just see what it looked like back then. Of course, Krause Department Store has been there since 1868, I believe, or 1886, something like that. So they've been there forever. They're still doing well. It's so great to see them. East Erie Turners, of course, they've flourished there for years. Of course, you know, they're not there now. But I just remember going there as a kid for New Year's dinner all the time with my grandparents. So it was really a great place, and it could be a great place in the future. We'll see what happens. But then in the 50s, as we know, it kind of just went, started going downhill. Less businesses were there, then, it just became more vacant spaces, and of course, it's not good for anybody, especially our city and all the people that live in those neighborhoods. But recognizing the need, when the East Side Renaissance was put together, your team recognized the need for this, and I applaud you for everything you've done. And Erie Bank, which has already been completed, is there. Mm-hmm. Meds, you attracted Olivia and her team to there, so that's so great that happened, because without East Side Renaissance, who knows what could have happened in the future. We were brought on the team given our experience in healthcare design and also adaptive reuse projects, so we're very excited to be helping Matt. And also, we're really there to ensure Matt's success. We want this project to be successful and to grow and to continue to help this neighborhood. 908, 912 Parade is actually the address of the buildings. There's 3 different buildings. And Danielle's going to talk about it a little bit, but it's a multi-purpose hub. It's going to house, of course, healthcare services, the dental office, etc. Of course, existing buildings, as many know, there's always challenges with existing buildings. There's some issues with these buildings, but the benefits far outweigh the challenges, because we're reusing existing building, we're keeping that history, we're going to try to restore the facade to what it used to be, and then we're going to put a new use in the building, so it's going to be a use that's going to be used by the neighbors, and it's going to benefit that neighborhood immensely. The accessibility, we're putting an elevator and a stair in, so that'll provide accessibility to the upper floors. So it'll be a fully functioning building. So with that, I just want to give an intro. Danielle, do you want to talk about the building a little bit?
Yeah, sure. I'm going to stand up actually so I can look at Paul and wait for him to give the next slide. When Meds and Eastside first approached us, we sat together and did a programming and block diagramming. Basically taking a look, as you can see on the screens, at each piece and part that Olivia felt that this space really needed. As we kind of mentioned, the pharmacy and the dental being really important spaces, but also including PT and OT and mental health and speech pathology. So kind of, coming to us, we kind of made a list of all these items, understood the square footage costs, or square footage needs, placement needs. And this really helps us, kind of just really enhance not only our efficiencies in designing, but also the overall user experience. Dave mentioned we're going to put an elevator in, and that just really opens up a wider variety of patrons that can use this space. Go ahead, next slide. So here are the three buildings, 908, 910, and 912. 908, they're all existing. 908 is the far right-hand property right there that's being pointed out. And that one is, Matt and his team had done a phase 1 review of the property and assessment and it was found that it was kind of beyond repair. So with that being said, the building will be demolished, but we have plans to reclaim the space, so don't worry. Go ahead. So these are the just high-level demolition plans. So inside the spaces, those two, 910 and 911, are actually connected inside as it stands. The first level is completely open and empty as it stands today, and the second floor is apartments. So we're gonna remove all of there's 4 stairwells in there right now. They don't really make sense the way that they are because of how the spaces will be connected. So all of those stairs will be removed, and we're also removing the front facades. But that is an attempt to restore the facades to how they used to be, or as close as we can find historical data to what they used to be. Next slide. This is just the second floor. Like I said, it's existing apartments. They haven't been occupied, and I'm not sure how long, Matt, but like Matt said, Eastside does currently own the property. So there's no issue there. So the first floor, you'll come into a waiting room. This waiting room will hold about, I think it's 20-some people. In discussions with Olivia and her team, you're not just seeing one person or 2 people. You're seeing a family of 5 or a family of 6. A lot of people who come here in numbers. So we wanted to make sure that this waiting room really accommodated that. We also wanted to be helpful with wayfinding. So right off of this waiting room, you have your reception. You have that first point of check-in. A lot of people, as we've discussed, who come here, English is not their first language. So having that receptionist there to greet you, to help you wayfind, to help you get through the building is really important and essential. And then, like I said, the elevator we're showing, that will go all the way from the basement, the first floor, and then to the second floor. On the first floor, we have about 3 or 4 typical clinic exam rooms. There's some office spaces for the doctors and their assistants, clean room, soils room, 2 restrooms, and then your PT and your OT spaces that I was discussing. In the front, we'll also have the pharmacy, but we've actually been working with Olivia and her team, have a pharmacy designer that they use, and we were working with them to also provide some level of privacy to the pharmacy so that there's a level of safety there. That is not to say that we don't want the facade to still look activated, so we've also been discussing ways to still keep that facade illuminated, potentially a graphic of sorts that can kind of really still excite and populate the front of the building, but also kind of, like I said, create that barrier of privacy and safety for the pharmacy. As we take the stairs or the elevator to the second floor, you're greeted with another waiting room and receptionist. This is kind of another nod to that, like I said, that helpfulness in the wayfinding and how to get through the building. You have these access points. This level, as Matt said, Olivia needed more space, so we have some offices, but these offices are really important because this is actually where patients will come and talk to healthcare administrators or people to kind of figure out how are they billing, and if they can't bill, like Olivia said, you know, what do we do from here? So we really want to make it accessible and kind of front and center right off of that waiting space. And then you also have ophthalmology, speech pathology, mental health, and then kind of in its own suite, we have the dental suite. There's restrooms as well on this floor, and then there's an open office and break area, and then actually there's this conference room, but I think a special part about the conference room to note is not only is this something that meds can use for all of their offices to kind of come and be able to have a meeting together, but also Matt is wants that conference room to be similar to the conference room that I think is on Erie Bank, in Erie Bank space, where it's kind of open to the community to use it and as needed.
Yep.
This is just the roof plan. It's kind of boring. It needs a new roof. For the ceilings, we're keeping them pretty simple. The waiting space, we want it to be awesome and cool. As you can see right here, this is a rendering of actually that waiting room. Kind of showing, kind of really trying to retain the existing character of the building. So these are actually exposed, existing structural, the deck above. And then the rest of the room, the clinic rooms, will just have the typical drop ceiling. This is to help in the acoustics of the room. We want to maintain that kind of patient-doctor confidentiality. And the rest of the space, like the corridors and such, we want to remain open to that structure, like I said, and really show the history of the building. On the second floor, the existing building has just plaster ceilings. So those are not really anything glamorous to be exposed. We kind of looked and did a little exploratory demo. There's nothing as beautiful as this is on the first floor, so we'll just have brand new gyp ceilings and then some more acoustics, like I said, to kind of keep that patient-doctor confidentiality. On the outside, this is the new stair tower, which you can see right here in this rendering. And then this is the elevator. In the stair tower, we're hoping to kind of have some level of glass glazing so that you can actually, it's illuminated, you can see some activity during the day and hopefully in the evening. So again, we're just trying to really make this space come alive. I think important, go ahead, Paul, to the next slide. An important thing to note is, so as I said, this is actually where 908 currently exists. This is the building that's being demolished. We're going to infill that basement of that property and regrade it so that it actually is a courtyard when you come off of Parade Street. So we'll have a gate, it'll be safe, there'll be monitored access to this space, but I really think that this will be something that highlights activity on this block and also a really nice ad for the building itself and the people who really use meds but live on the east side and go on Parade Street.
We're starting with this all.
Do you want to?
No, you.
We're also going to be restoring this facade, as I mentioned before. We're going to be demoing most of this, but really trying to recreate, like I said, how it used to be. And like I said, with the safety of the pharmacy, still trying to show activation and light, but want to have that layer of safety. So having some type of frosting. Maybe some colorful graphic. I know Olivia's mentioned a lot of times you see opportunities here, and then even that graphic to maybe engage a local artist to do some of these install. So once again, just really weaving that fabric of the community and what Eastside and Mets is all about. As you can see on the screen, this is the kind of overall palette of finishes. We really wanted to feel like home when you come here. Here's a nice sketch, just kind of showing what contained a lot of the. Libby, are you okay?
No. I'm just so excited. I can't stop talking.
We want to retain as much as we can on this first level of all the exposing existing brick walls. So that's kind of a theme throughout. And then, like I said, the wood structure we want to show, keep exposed. That's it. Any questions?
Thank you, Daniel.
I'm not contagious. I work with doctors. They said I'm not contagious.
The questions I have are related to the capital stacking at the end. So when we get to that section, when we should go there, just
Go for it.
Okay. I just see that, like, so there's like 4 pendings right now, and so with the pendings that we see, I'm just curious, like, how pending is that pending? Is
State
there
budget, we talked to all those, a lot of those are state-oriented, and then the Erie County DEI Commission, of course, I think their award comes out in November, so we don't know what that looks like. We've applied for that. So the project is a $4.8 million project, so we're over that amount, just in case something doesn't come through. So we build a
buffer so to speak?
above,
Okay.
yeah, just in case.
Has the CRIS already
CRIS,
committed to?
We presented to the CRIS, and they're waiting on our state budget to clear also.
Okay.
So they've approved as far as our presentation to them.
Actually, I know that they approved the parking garage, I know that they approved the hotel. Were you in that batch?
We were not. They're waiting, they want to wait till the state budget passes, and then we present it, and then they're going to come back to us. So we know it's 26, so that's what Brian and their team demonstrated. So we're okay with that. You know, we're not ready until the capital stack is complete, but we presented, given them the numbers, and so we're confident with that.
And then that $1 million coming from the city,
Part of Chris Groner's program, the low-interest loan. Yeah.
so, but you said that that's not moving until next year anyways?
Well, we don't anticipate, it's November now, so 26, we would like to make that happen if we could. And I'm getting that from Chris. Chris was supposed to be here, he's gonna be here to talk more about that, but he's not here.
Yeah, I requested for Chris he'll be at our caucus to talk about where loan monies are right now, what's out, what's coming back in.
Right.
So we have a better
Right.
sense of,
What that looks like.
can we do that? Can we offer a loan? Do we have that money to offer a loan?
Right.
If everything works out, I mean, when can I walk into the doctor's office? When are you anticipating that I'd be able to come after work and go to the doctor? Stefan?
I'd say depending on the bidding environment, it could take a year for construction. We have to finish documents, which we're still in the process of. We're in the schematic design phase, and we have to go to design development, and construction documents, and then bid it out. There's going to be a construction manager. So I'd say, with that said, maybe 18 months or sooner. Again, I don't want to promise something and have it be not possible. So.
If we can build it, I can staff it. I'm very confident. Like, we went from, when I started at Meds, we had 3 primary care providers. I've been there 18 months, now we have 12. So I know that as soon as construction is complete, I will be able to have physicians in this building.
Question for Meds. Why do you guys continue to rent spaces and not buy your own building?
Well, we did buy our own building
Okay.
actually in August. It's a delicate balance. So we go where the need is, and there's a need in this neighborhood. You can look at unmet medical need scores. This is the highest unmet medical need corridor in the city of Erie. There's nothing here that we would have wanted to purchase that Eastside Renaissance didn't own.
Already have.
Yeah, like, we're in the basement of the JFK building because there's really high unmet medical need, but there's not a lot of property there that's not suited, that turning any existing building into a medical clinic is very expensive, I guess is the short answer. I could keep going on that. We do own 2928 Peach Street.
Okay, so the Peach Street location is yours?
We own the Peach Street location.
How does Wayne School tie into this at all?
Two different clinics, yeah.
And the East Avenue one, the same thing, there's some kind of community.
UPMC just put a
Okay.
facility there. I think two different things. And I know they talked about their needs also with the ERs, as Libby explained with ER. So alleviating that emergency room dynamic, they're all working together to do that.
And I know the primary health network that's over in Wayne has somewhere around like a 6-month wait list for some of them. So it's not, like, even if these were to be that close to each other, the need is so high
Yeah.
that it would be met very, like, I don't think that they would be pulling from one another.
Have you guys talked to the EMTA about possibly having a bus route go up Parade Street? 'Cause I know that when we first did our walkthrough, when you guys, almost 2 years ago, I had mentioned that there's no
Access to that.
Yeah.
Yeah, we're in that, once construction begins, that conversation is part of our to-do
Okay.
list, absolutely.
All right, because
Yeah.
like I said, I used to live in that neighborhood, and there's one that goes across the, I think it's
10th?
6th, and then the 10th.
10th,
So
yeah.
you have 4 blocks of elderly and
Yeah.
unable-bodied people who,
When the snow hits
Yep.
and, drop off right in front will be
I mean,
very important.
you drive that area, you see people walking carts of dirty laundry up
Yeah.
to Denny's,
Oh, yeah,
so
we see
you
it.
know the need is there.
Yeah. Agreed.
I'm melting. I'm sorry, I can't stop coughing, guys.
It's
okay, it's all right.
To come, if the city were able to do the loan, would that make any of these that are currently pending fall into place? Because that's
No.
like one of the biggest ones that I see on here, right? The direct one is the city, other than the Chris.
On Erie Community Foundation.
Yeah. The foundation's is supporting this, we'll be supporting, it's just a matter of 26, we're gonna apply, Meds is gonna apply for that, so that's a go. The state, of course, we're all waiting for the state budget, but we've had our conversations with the PA Black Caucus and their leaders, the Speaker of the House, and so those things are in good favor, regardless what happens with that, but as far as the city's approving this, it's not gonna change anything. We'll just
So I guess
hopefully
then my
have a-
counterpoint would be, us approving it might be ahead without anything else in place. Like, would us approving it, the project couldn't necessarily go forward because you would still need some of these other big ones to follow.
Yeah, I couldn't answer that. I know what you're
Yeah.
asking. I know what you're asking.
It probably would help the CRIS. The CRIS is prepared to come in once we have more things secured. So being able to say that we do have money committed from the city would go a long way. in helping us.
Locally, yeah, I guess that would say local.
Okay.
Yeah.
These are the projects that I get very excited to push for.
Good.
This is so incredibly critical, especially on the Lower East Side. There's just so many decades of disinvestment that it has taken a toll, and it shows up in every capacity, from infrastructure to a person's well-being to, you name it. It is evident and present.
Yeah.
And when we see what is about ready to happen at a federal level, to be able to provide something like this within a local level, I think this is how we respond. And so I'm hoping that these other places are able to step in. I know some of this is reliant on the federal, but things like the CRIS, I really hope
Absolutely.
that this is considered and put in, because this is the kind of things our community needs
Right.
desperately.
I appreciate that.
So, within, when you're talking about the CRIS funding, that only funds specific things. It's not just like you have 1.2 million in that project that fits with CRIS funding. And to give you an example, like in Lancaster, they ended up using CRIS funding to build a parking garage, but really the parking garage was a front for them to put in a library, because they couldn't just build the library, but they were allowed to use it for parking infrastructure.
Okay.
There's really specific things you're allowed to do. You're not going to be able to build up and put a roof on, but you're allowed to do like foundational and demo type stuff. There's specific things. So I just want to be clear, so you've already worked through that with their board or their director to make sure that the portions of your project that you're looking for that funding for are the ones that they're allowed to use to fund it?
Absolutely.
Okay.
Oh, yeah.
I even remember them asking about equipment.
Mm-hmm.
Taking a step further and saying, what, you'll need equipment here, special dental studio, that type of thing.
Yeah.
So they took a step further and said that they have funding
Funding for-
that, so they asked about that
Yeah.
Yeah.
number.
Yeah, it's so narrow that, you know,
Right.
you have to
Yeah.
like milk it in different directions. It's
Right.
not
Yeah.
like, you know, we extend the revolving loan fund on this and here's $1 million, go get it done.
Right.
Theirs is so
Specific.
narrowly done.
Yeah. Yeah, I think we went around their board like 3 times. But we got it done and they see the value also and the need for it. So, yeah, so we've addressed that.
Yeah, they're on board, and we have a good understanding of what's covered. I helped Brian map the map for it, so I took him through the community, we went to each building, talked about specifically what we were doing to the buildings, and what would be qualified before we met them to present this. So with those conversations, the only thing that they were very clear that they don't help with is like operational costs or
Right.
anything like that. So pretty much everything in the next project is covered in this funds.
Any plans to engage the community about this project?
Well, we did that before it started, and the need, and through Olivia's network and the things that she had done. And I think, I'm not gonna say it speaks for itself, the need of the medical because of the life expectancy, but we're gonna continue to engage the community. That's what we do before we go do anything next. That's what we do. The banking, the financial piece, the community will always be put first. And we don't just roll the dice and say, okay, this fits, this looks good. We get community input.
And I think even as Danielle noted about the exterior courtyard, murals, artwork, you know, that outdoor space, what should be there? I mean, those type of things, they could definitely have an input on. That'd be so great to
Absolutely.
get a group together and talk about what could that be? What more could it be? That'd be exciting to see that.
Yeah.
Is area insurance very involved in this?
They've
Are they
financially supported, absolutely. Yeah. And they were actually the donation of the property 6 years ago as a part of our projects. This is one of the properties that they supported. So, but they're a part of the NAP, the Neighborhood Assistance Program, grant program, NPP. Yep.
So is there any other asks involved? Are you good with zoning, good with infrastructure, any other, the main thing for ask of city council is the revolving loan funds to see that goes through. Is there any other asks?
Zone meeting?
Sidewalks.
Oh, we did meet with the city and we talked about, the need for parking. There was a need, I think, for about 5 spaces. And, it's allowed to be within a 500, foot radius, I believe, of the property. And I believe, Matt, you guys were looking at, property adjacent, for that to be fulfilled.
Hopefully, yes.
And then if not there, we were also hoping to have discussions about accessible parking outside of the, closer to the address. The other thing we had talked about was street trees. We were hoping that was something that was,
Lighting.
they were excited about that.
Lighting and street trees, clean the sidewalk up.
Lighting, street trees,
Yeah.
activation of that area.
Yeah.
But there was no additional concerns, I believe.
In what way was it you were hoping for the city to provide parking? Like the street parking is metered and you don't want it to be, or there's an empty lot that you want to turn into a parking lot? Was there a specific way you were hoping to address that?
There was,
I think right now, more of the street level parking until, there's some other properties in the neighborhood that.
I was gonna say, you're in a waiting game right now. I know
Yeah.
for Appliance in the other buildings, I know he won't sell.
yeah.
I've heard from him he won't sell.
Absolutely.
So, so I'm assuming it's a waiting game to be able to finish off whatever your game plan is.
Right now be street level, and we're working with the Benedictine Sisters, which is a building, they're behind us, And, you know, there's no room behind there, of course, but they're really accommodating. They like what we're doing, cleaning up the area. We're taking down some trees that are on their property, which they're excited about, opening up their little garden in the backyard there. So, but it's, yeah, parking's gonna be tough. It's gonna be a challenge. We understand that. Until Bobby
Most
decides
of
he
your
wants
clientele
to.
are gonna be walk-up though, you were telling us,
Yeah.
right?
Yeah, it's gonna be mostly walk. We
The
feel mostly
parking's
walk
probably
up.
for the people
Yes.
working.
Right.
I think for, as a medical clinic, it's going to be important to at least have 2 or 3 parking spots right in front of the building that are marked handicapped accessible.
Yeah.
Parking authority.
So I don't know if that answered your question.
I was going to note also that it is a change of use, going from the residential in the upper floor to the, to this, to the healthcare. Well, it's a business occupancy, but also we're going to bring the building completely up to code. The energy code, also the accessibility. So there's nothing that's not going to be done, and we have to do that. And we're going to do that anyways, so.
And then the lot consolidation is required, but that's something that is
Yeah,
easily.
it'll be
easily
one lot. There's
handled.
3 separate lots
Yeah.
now. It'll be combined into one.
Yeah, we apply for that special deed.
Matt, did you buy Dr. Collada's old building on 8th and Parade there that got?
Lecom actually owns it.
Oh, Lecom does, okay.
Yep, Lecom, up on, and their newest location's up next to
Eighth.
Mighty Fine,
8th
Right
and
across
Parade.
from Mighty
right
Fine.
across from Mighty Fine, yeah. There's a vacant lot, there's a lot there that's just grass now. They tore down this building, and Lecom owns that.
Is that on the corner?
On the
Or-
corner.
Yeah.
Yeah, right there.
Yeah,
was
he
just-
was right on 8th and Parade
Mm-hmm.
there.
I just know that the parking lot for Lecom is very interesting. It has like 2 different entry
Right.
points, so I know
Yeah.
you can take the corner and get
Go
in,
around.
yeah. So I was curious.
Yeah. So. That's all we got.
I guess the game is buying up what you can until you finish off what you hope and dream.
Right.
Because right now, there's a lot of things that are going up for sale, and they're just pieces. I'm curious to the puzzle.
Yeah.
Are there any other questions?
Nope. In January, we will be having a new mayor and some new council members added to the equation, so let's see how this hope and dream pans out.
Yeah, I think it's very great and project. It's going to bring Parade Street back to the light where it once was. And personally, you have my total support
Thank you.
as a council person for the next 2 months, and as a citizen, I'll be out there.
Appreciate you.
I have 5 minutes to say what I want to say.
Appreciate you. Thank you, sir. Right, right.
We appreciate your time and your presentation. Thank you very much.
Thank you, guys.
Very
Appreciate your time.
exciting.
All right, thank you, guys.